Hello, my name is Randy Beckett, and I am with Encounter Telehealth. I am a psychiatric nurse practitioner and vice president of our geriatric psychiatry services. I'm going to talk to you today briefly about two problems that are commonly seen in your residents. One is depression, and the other is bipolar disorder. So depression can start at any time in a person's life, especially your residents after they perhaps move from their home to the facility and they have transitional issues, or as they have health problems that come to bother them, or after a hospitalization. It's very common to have depression after a stroke, after a heart attack. So there are several key symptoms of depression. The first is sadness. And this can be a depressed mood, or the person just isn't what they used to be in terms of how outgoing they are as related by the family or what you've seen. And so they're just glum and not feeling very good. The second is a loss of interest. So this could be that the resident isn't going out to activities as much as they were. They're not going to activities in the dining room or for eating with others, and they just don't seem to be interested in doing much of anything. One of the other common symptoms are a loss of energy. So they can not have the energy they used to have, or they just seem to be lethargic. Another common symptom is a psychomotor, or what we just call retardation, a psychomotor retardation, where they're just kind of feeling kind of heavy, that they don't want to move very much, and they're just, once again, lethargic. The last thing that's very common is a sleep disorder, where they are not sleeping at night, and of course this results in loss of energy during the day, or they may be able to get to sleep, but then they wake up at night and can't get back to sleep. And of course the most serious thing associated with depression is a risk of suicide. And the most dangerous thing for suicide is if somebody has had a previous suicide attempt. So that's the thing that you want to find out, has the person had any previous suicide attempts, and that puts them at a much higher risk for suicide. So if you recognize these symptoms in a resident, even a resident that's on an antidepressant, it could mean a couple of things. Number one, their depression has worsened. Number two, that perhaps the antidepressant that they're taking is not as effective as it once was. Some people are on these things for decades. Perhaps the antidepressant needs to be adjusted, increased, or changed to another antidepressant. Or sometimes another medication may need to be added. This is why I encourage you to have every patient who's on any kind of psychiatric medicine, such as an antidepressant or anxiety medicine, or especially a antipsychotic, to be seen by one of our psychiatric nurse practitioners to properly manage these disorders. Now we're going to talk about bipolar disorder. So bipolar disorder means not that somebody's happy one minute and sad the next. It means that they have mania and depression. So mania is typically if somebody is really fast talking, like they talk like this and they just can't seem to stop talking, and they're always wanting to do something, and they're very restless, and they're just very hyper, and that's just the way they are. And so this persists for a period of time. A second common thing is people who just don't sleep at night and they don't seem to be tired. So if they don't sleep at two or three nights in a row, then they can go throughout the day and they're not tired. Another thing is that they have very rapid intrusive thinking, where their thoughts just go all the time, and they can't stop from thinking. Another thing is they might have what we call delusions of grandeur, where they just think that, that they're bulletproof, that nothing can possibly happen to them. And another thing that you would see outside of probably your facility is that people will do dangerous, risky things like drive a car real fast, or they'll spend money that they don't have that kind of thing. So what we look for is history of a manic episode sometime in their past or recently. So people can have manic episodes maybe a long time ago, but then they can go into a very deep depression. So there's like a manic type of bipolar disorder where people are mostly manic and really hyper. And then there's a depressed type where people are mostly very depressed. And this depression can be severe to where they want to commit suicide. And if they come off of this high, then they go down in this depression, then they can become very, very, very seriously depressed and are at risk of suicide. So there's also what's called Bipolar II disorder. That's Bipolar I that I just described. And Bipolar II is where people have these episodes of mania and depression, but they're not as severe. So somebody might be hypomanic, that what we call is just a little bit manic, where they're a little bit hyper, they have a little bit of these symptoms of not sleeping at night, they have a little bit of the rapid speech, and then they have a little bit of depression. And this can also be treated effectively. So both of these kinds of bipolar disorders need to be treated by a psychiatric nurse practitioner because they are very difficult to manage sometimes, and people can have very up and down moods over a period of days, and other medications can actually aggravate it. So you can possibly give somebody who has bipolar disorder an antidepressant and they can get worse. So it's very important to have a psychiatric nurse practitioner manage these disorders. And it's important to recognize mood changes in people and make sure that whoever your ADON or charge nurse is aware of these changes so the person can be referred for proper psychiatric care, because these people are suffering. And depression, anxiety, bipolar disorders are serious illnesses that lower the residents' quality of life, their family's quality of life of having to go through this with their family member. And it also makes it much more difficult for you, the staff member, to help provide care for these folks, because they can be very unstable, they can be agitated. You can also have agitation with depression and bipolar disorder, as well as anxiety, which we didn't discuss much. So it's very important for these folks to have proper psychiatric care. And it's important to educate yourself and maybe watch this video a few times so that you can understand what's going on and be able to recognize these symptoms immediately and make sure the folks get under care as soon as possible. I want to thank you for your time. I hope this has been helpful to you, and you can talk to your provider, Encounter Telehealth provider that provides services for your resident, and they can always give you more information about these disorders. Thank you.